This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Is your body's slow runner as it controls everything that you do. It directs our actions, enables us to feel emotions, and helps store memories. But along the way, the brain can develop diseases that can manifest in various forms, such as in trauma, tumors, and infections. A lot of research efforts have been put into numerous brain disorders. One of those who have sought to study the intricacies of the human brain is Dr. Patricio Reyes, a leading Filipino neurologist and scientist based in the United States. His study, along with many other scientists from around the world, paved the way for the development of an inexpensive, natural prevention and treatment of degenerative diseases of the brain. This drug-free strategy allows patients to deal with the numerous brain diseases and conditions. It is also aimed at individuals who want to sharpen their memory, concentration, and comprehension, among many other skills.
And joining us tonight is Dr. Patricio Reyes, a leading Filipino neurologist and scientist based in the United States and the director of the neuroscience program of the Phoenix Brain. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Reyes. It's an honor to have you on the show.
Thank you for inviting me.
Welcome to MedTalk.
Thank you.
Our brain, Doctor, the most complex and most protected part of the human body. Please help us understand how it works.
Well, the brain is made up of billions of brain cells we call neurons. And they're constantly communicating with each other. So it's like a huge network. And they don't rest. Mm-hmm. They're connected with each other through trillions of what we call synapses. And in order for the neurons, the brain cells, to function well, this, what we call tentacles, have to connect with each other, and they have to have a chemical that makes them communicate with each other. Mm-hmm. And it controls everything in our body. And the brain has, let's say, for instance, as different roads or expressways, if you will, mm-hmm. and they're all connected with each other as well. But each road carries a special function with it, all right? And this is very important in understanding how the brain is rewired with our latest technology later on. And I want to emphasize that the two major misconceptions that were taught us in medical school have been disproven.
Mm-hmm. What are these two?
And these are the principles of this was the teaching that when we are born, a few years after we are born, the brain is hardwired. Mm-hmm. That's no longer true. We can rewire the brain. The brain is plastic throughout life, from beginning to end. All right? That's one. Second, we were also taught that when we are born and after a few years after we are born, that's all that you have in terms of brain cells, mm-hmm. Angel. But that's no longer true. With this technology, we can now make the brain cells produce new brain cells.
Mm-hmm. And this is upon your research, your very fascinating research on the plastic brain,
yes,
if I may
yes,
say so.
Yes.
Mm-hmm. And you mentioned, doctor, the roles of our brain, or the main functions of our brain. Let's talk about that as well.
Actually, the brain power is probably the one that distinguishes us from the rest of the animal kingdom. Because we can think, we can reason out, we can predict that the animals cannot. Okay? So, aside from thinking, language, hearing, vision, speech, it also controls our lung function, the heartbeat, kidneys, our motor function, like our ability to walk, our ability to feel, our emotions, our behavior.
Yes.
And these are all controlled by the brain. The way we socialize. So without the brain, we are really, our activities of daily living and our quality of life as a whole is compromised. We can have the best heart, the best lungs, but if your brain is damaged significantly, then the quality of life is really seriously affected.
Just as when someone suffers a stroke, one gets paralyzed, and that's the quality of life suffers.
Yes, and also, let's also take this as a disease not just of the patient, but of the family. Because when somebody is paralyzed, as you said, then somebody has to care for him. He will be dependent on his wife or children or somebody else, because he can no longer maintain his health habits, cannot eat by himself, and the problem of communication. And there is, because of these limitations now, infrequently, patient becomes depressed because he can no longer drive, so, and the feeling of independence is lost. And that's why when we care about patients with brain impairment, like strokes, we need also to address the emotional aspects of that disease.
And you mentioned emotional, and you mentioned also the daily activities that is very much connected to our brain. So how integral, or is there a certain switch that goes on in our brain when we do all these day-to-day activities?
Yes, it's a very complicated process, actually. Like, for instance, if I ask you to close your eyes, touch your right ear with your left hand, those are very complicated commands.
Yes.
The reason is, in order to understand that and to do that, you have to hear, okay? You have to know which is right or left. You have to be strong enough to lift your hand and touch your ear. So we take this for granted.
Yes, we do. Yes,
and
I agree.
Well, in fact, these are very complicated processes. And for instance, now with technology, for instance, if I ask you to read, I have an idea of what part of the brain is working. Okay. By asking you to write, I can predict what part of your brain is working.
Really, how do you do that, doctor?
Well, we have what is known as a PET scan. PET stands for positron emission tomography. What it does is it tells us how the brain is working, what part of the brain is working when we are doing something. So if you're writing...
For example, I'm writing now.
If I put you in a PET scanner, I'll be able to tell you, show you, I know where it is, but I'm going to show you what part of the brain is stimulated. And this is important because if one, for instance, has a stroke or a tumor in certain parts of the brain, we know what highway or road is affected. And the technology that we have now is we can rewire the brain by making the neighboring brain cells grow and grow back and take the task of these brain cells that were damaged.
Wow, it is complicated. It is interesting and very fascinating.
Yes, indeed.
Aside from the rewiring that happens when you said, let's say, for example, the patient suffers a stroke, I wrote this down, highway or road. So the road or the highway that a female brain and a male brain may take is very different, I understand. So please help us understand
some
that.
differences, yes. There are some differences. And as you know, part of the brain's development is governed or affected by hormones. The female hormone is estrogen and the male hormone is androgen or testosterone. So depending on the gene, of course, will determine whether a fetus will become a woman or a man. So double X is a woman, XY is a man. And then, while in development, while the fetus is in the womb, then it's subjected to different hormones, and one of them are what we call sex hormones. So if there's too much androgen in a female brain, you may end up with somebody who's a tomboy. If you have too much estrogen in a male, the brain the person may become gay person. Okay, and that is the thinking. So it's biological. Our behavior, our personality, many times are not our choice, and it is determined biologically, even when we are in the womb. Now, that's not to say that the environment has nothing to do.
Yes.
The environment, I mean physical and social environment, can modify that. But the reality is, it was determined even before we are born.
So which is more important then, doctor, based on your research and based on your practice? Nurture or nature, or a combination of both when it comes to brain development?
Yeah. Mother Nature, we have to know what Mother Nature has done, all right? And then based on that, we also have to respect the influence or the effect of physical and social environment. Let me tell you, it's interesting because if a friend has twins, for instance, and a baby girl and a baby boy. Now, let me tell you. So we bring gifts to visit our friend who just delivered these twins. What do? To the girl, we offer or we bring a pink dress and a doll.
Yes.
The boy, a blue shirt,
maybe a ball.
And a ball.
Yes.
Why is that? Tell me. Telling us that there's a difference in it.
Our brain has been trained.
Exactly. Both the parents, for instance, friends and relatives are trained to do that.
Yes.
It has some basis in the brain as well. And you try to give a baby girl a soldier, for instance. She will throw it away.
Because at that age, he also has been trained already. Unconsciously.
The premise is that, you know, it's a different brain. It's reacting to different stimulus.
So we can give a little girl a toy soldier and hoping that she won't throw it away. Or we can give a little boy maybe something with a good mix of yellow and pink and hopefully he won't throw it away. But doctor, we'll talk more about the very interesting facets of our brain and get to discover more about it when MedTalk returns. We're back here on MedTalk, still talking about brain development. This time, doctor, let's talk about diseases and conditions of the brain. Let's start off with an injury to the brain.
Yes, the injury to the brain can be due to many causes. Many years ago, in the early 1900s, Dr. Martland from the United States described what is known as dementia pugilistic. What it means is that there is brain damage and it is manifested as memory loss, confusion, difficulty carrying on his daily activities among retired boxers. So they get slower, their balance is poor. And I think many of us have read about retired boxers having problems like that. And that is believed to be due to a series of concussions, head injury, all right? And it doesn't manifest right away, but it may take months or years when they retire. And the modern term that we use now is chronic traumatic encephalopathy. When you look at the CAT scan and the MRI of the brain of these individuals, you don't see anything. Yet their brain is not functioning anymore. So I believe that the problem is biochemical rather than structural and physical.
But also in understanding our brain and its function, doctor, we'd also like to understand that what happens to our brain during a concussion? Is there something that pops, or is it chronic that over time that's when it gets more damaged?
Yes, what happens is I believe that in concussion you damage the brain without showing any physical evidence at that time.
Okay.
Patient or individuals with concussion may just complain of being dizzy. It used to be thought that you have to lose consciousness. That's no longer true. You can just see stars or get dizzy, and for a moment you may not be able to answer questions, but after seconds or minutes, you're back to normal. And that's dangerous because you feel you're all right. What we now have evidence that in concussion, the individual may feel all right, but if you look at the brain by, again, PET scan, the metabolic status of the patient, that means the way the brain functions. Actually, there are abnormalities that persist up to 2 weeks. And we have evidence that if you have more than one concussion, then it leads to more persistent and long-term damage to the brain.
Just like our boxers, doctor,
yes,
you know,
exactly.
A lot of blows to the head.
We try to educate boxers, their coaches and trainers, how to train properly. The importance of hydration. Because we have...
What is the importance or the link of hydration to the brain when it comes to sports?
Okay, because if you exercise, you lose water and electrolytes, okay? And that determines the balance of fluid in the brain and the blood. So if you don't replace that, then you can dehydrate the brain as well. That boxers, as a rule, try to do that to make the way in, since they have to have a certain weight.
Yes.
Depending on the division. So what do? They try to lose weight by exercising too much within a very short period of time. Some of them even would try to throw up. All right?
Just so they lose
yes. Some of them will take a water pill.
Yes.
So all those things are unhealthy.
This holds true also for those who are not into professional boxing or football or any other professional sport. Just an individual who would like to exercise.
Yes.
And to those who are not even into exercise, but who just like to keep their brains healthy.
Yes, that's very important because many of the things, the elements that circulate in our blood can go through the brain. Not all, because there's a selective process there, but it can affect the brain.
How about headaches, doctor, in relation to affecting the brain? Can it lead to further damage to the brain if you have recurring headaches?
It depends on the cause. Headache is a sort of a very common non-specific symptom, all right? You lose sleep, you get mad at somebody, you're hungry.
Yes.
And so it can be due to many causes. The key is it a recent onset headache? That's important. You were fine, all of a sudden you have this headache. Now, there must be a reason for that. all right? Second, how severe is it? Then we ask about what are the associated symptoms. Is there fever? Fever may indicate infection. Is there associated nausea? Parang yung nasusuka. Tapos throwing up, yung nasusuka na. Is there associated weakness, numbness, speech difficulty? So you have to ask all these questions because the headache may just be one of the many signs and symptoms.
Could also be an underlying medical.
Yes.
It could be just masking
yes,
some other health condition.
Yeah, absolutely. The most common, of course, particularly in women with due respect, is migraine. All right?
Okay.
It's very common. And it could be before, during, and after puberty, or after, before, during, and after menstrual period.
After mentioning the injuries to the brain, now let's go to diseases that may happen to our brain, like a tumor. Doctor, please help us understand this.
The tumors are a common cause of brain injury as well. Unfortunately, it accounts for less than 1% of all the tumors in the body. But the problem with the brain is it could be a benign brain tumor, but if it sits on a critical part of the brain, you can have disastrous kind of consequence, very serious effects.
Which area of the brain that you mentioned is very critical with this benign tumor?
Well, whenever the brain is located in a place where there is very little space in between the bone and the brain or the spinal cord.
Okay.
And because your spine encloses the spinal cord and the nerves that come out. Now, just a little tumor there, even what we call a benign tumor like meningioma, it can cause complete paralysis because there's very limited space there. So, and that is a very benign lesion. All I have to do is remove it and the patient is well again.
How about the symptoms that accompany this benign
symptoms
tumor?
could be weakness, numbness, and they can complain to you in the spinal cord that, doctor, I don't feel well from this part of my body down. And that's what we call the sensory level. So it's a giveaway because now you know where to look for.
Yes, yes.
Yes. It's not easy all the time, but if you are keen, you will be able to sort this out.
And the onset of a complaint in the areas that you mentioned is...
it's very important. You don't take those symptoms lightly because, again, within 24 hours, the patient could really deteriorate. Now, another thing about brain tumors, the most common brain tumor is a malignant tumor, unfortunately, and the treatment is just not available to remove the tumor. Even if you do surgery, radiation therapy, and chemotherapy, it's one of the hardest tumors to treat.
But
because the brain is unusual, the tumors in the brain, like for instance, in the tumor of the muscle, the nerve, or the bone, you can cut the tumor away.
Yes.
Yes. The brain, you cannot do that.
You can't cut that certain part and then just... You mentioned earlier it can grow back. The cells can go back.
Yeah, but the brain is a gel. Remember that? It's a gelatin.
Yes.
What is that in Tagalog?
Yeah.
Gulaman. Parang gulaman.
Yes, doctor.
Try cutting a gulaman.
Wala na, hindi na.
It's
That's
very
it.
hard. That's
Yes.
the brain. That's why what we do, we suction. The rest of the body, we can cut around it.
Okay.
The lungs, that's why you can remove one lung, a
Yes.
portion of the lung. That's fine. The brain, sometimes you can, particularly if the part of the brain that's involved is not critical. But to diagnose what a brain tumor is, in the brain itself, not outside, but inside the brain, is to suck it. You suction it.
Does it also hold true for water on the brain, hydrocephalus?
Yes, it's an interesting question because when we are born, the skull is not really hard, very soft, di ba?
Fontanelle.
May fontanelle tayo
Yes,
dito.
yes.
Kung mataas ang pressure sa side ng brain, o kaya there's water, for instance, yun ang unang pinapalpate natin. Pag nagpo-protrude dyan, it's indicating that there's high pressure.
Or when the baby is crying, you'll notice the fontanelle.
Because tumataas ang pressure niyan. Yan. Ngayon, now, unfortunately, some babies are born with too much water in the brain. It's called hydrocephalus, right? Kasi ang tubig sa brain, the water is called cerebrospinal fluid. Ngayon, it has to circulate around the brain and around the spinal cord. Ngayon, pag nabablock yan, hindi na makasirculate. Kaya naiipon. Ang bata, lumalaki yung ulo. Kaya hindi ba, may nakikita tayong bata, malaki ulo, saka yung mata,
nagbabalge
yan. Yun ang hydrocephalus. Yun ay madaling gamutin pag na-diagnose agad. Kasi, i-drain natin ng fluid from inside the brain into the stomach at hindi na nababara. Diba?
So dapat talagang ma-drain.
Yes.
There is a way para lumiit or matanggalan ng tubig yung ulo ng batang may hydrocephalus.
Sa pag malaki na tayo, nagsara na yung utak na nung skull natin.
Tumigas na.
Tumigas na. Kaya kahit may tumaas ang pressure sa ulo at saka may marami tayong tubig, sakit ng ulo, nahihilo, nanghihina.
Iba namang symptoms.
Nasusuka rin, gano'n. Ganon din ang treatment. I-drain natin, ganon din. Gagaling na pasyente. Pero ang symptoms ng hydrocephalus sa mga matatanda, iba. Parang dementia, parang may Alzheimer's disease. Kaya maraming misdiagnose natin na may tubig na Alzheimer's disease. Pero hindi Alzheimer's disease. Kasi makalimutin din sila. They forget. They get confused. Pero dalawang kaibahan. Ang paglakad nila, iba. Natutumba sila.
Kasi those with Alzheimer's.
They shuffle. At saka they fall. And they may lose their ability to go to the bathroom. So, they wet their underwear. They have what is known as urinary incontinence.
Pero doctor, when we started, we talked about how our brain is plastic, how we can train our brain in relation to the two that you just mentioned, Alzheimer's and the symptoms. We'll talk about neuroplasticity, Dr. Reyes, when MedTalk returns.
Composed of many layers, your skin protects you from possible germs, infections, and other harmful elements. But its constant exposure to the wind, sun, and other destructive ingredients in the things that we use can often lead to damaged skin. This often leads to the invasion of skin bacteria, most noticeably present in broken skin, such as in dermatitis and eczema. Some bacteria may also enter the body through wounds, sustained from various day-to-day activities such as abrasions or superficial damage to the skin, lacerations, among others.
Some of the signs of wound infection would be redness, warmth in the area, non-healing wound as expected, and of course the presence of pus that might complicate management.
Through the years, many methods have been employed to heal wounds and protect against infection, such as swabbing and washing thoroughly with water and other antibiotics.
We have to make sure that patients with wounds will be able to prevent infection at the site of the wound.
But today, we all know that these are not enough. Aside from seeking professional help, many medical experts also suggest self-care, especially when preventive measures fail.
Many of the medical conditions, including minor cuts and abrasions, would not necessarily need medical attention. So, sa level ng pharmacist at pasyente, pwede na tayong magbigay ng mga recommendation to manage the treatment.
Fusidin is a unique antibiotic. It is a class of its own. It's a powerful antibiotic that is clinically proven effective against bacterial and skin infections. It is fast-acting. In fact, it starts working 2 minutes upon application, and it is deep penetrating. It is seen in the deepest layers of the skin 30 minutes upon application. It's available in the ointment form for dry cracked lesions, as well as the cream form for those wet weeping lesions.
Well, fusidic acid, when you compare it with other antimicrobials available in the market, well, it has a lot of advantages, such as number one, it being deeply penetrating. That means to say the antibiotic preparation can really work through the spread of the infection.
At the end of the day, the right care, treatment, and meds are all important to greatly reduce the risk of infection to promote the healing process.
We're back here on MedTalk, still talking about brain development. You may join the discussion by calling our hotline at 548-4678. Dr. S, now we'll talk about brain diseases. Let's start off with understanding a stroke. Which part of the brain is affected when one suffers a stroke?
Yeah, yung stroke po is due to lack of blood supply to a particular part of the brain. All right? So, the lack of blood supply could be due to heart stoppage. Pag tumitigil ang puso, di wala nang makakapunta ron. Then you have blood clots. All right? There are different types of blood clots. Ang usually sources ng blood clots, yung carotid dito, yung ugat natin na pumupunta sa ulo from the heart or from the heart valves. Dito, I have seen many patients here who had strokes at an early age. Kasi we have many patients who have rheumatic fever. Isang effect nun is nasisira yung valve ng puso.
And it doesn't, no matter what age, no, Doctor?
Yes, yes.
In the elderly or the younger
So,
ones.
because of the problem in the valve, there is abnormal circulation in the heart. So it gives rise to small blood clots.
Okay.
And that can plug the blood vessels, the blood flow. Or you could have too much cholesterol plaque magtatanggal, then it blocks the flow of blood to the brain as well. So what happens? So if you plug the blood vessel, the part of the brain that is being supplied by that blood vessel dies. And you have a stroke, then the areas of the brain that control the parts of the body, like speech on the left side, usually here in the temporal area, then you lose that, or you have a defective speech. And if the sensory portion of the brain is damaged, then you lose your sensation. If the center of the brain, like the motor cortex or yung tentacles niya that allow us to move is affected, then you get weakness or paralysis.
Are those the first few signs that one is suffering a stroke? Speech, paralysis?
Well, they can have headaches, and the sign that we look for are parang temporary weakness and numbness, speech difficulty. Many times they resolve. So that's what we call TIA, transient ischemic attack. Okay? Okay. Para ba yung puso din natin, minsan bago mag-heart attack, sumasakit ang puso natin. Yun ang counterpart ng angina dito sa puso. Dito, TIA ang tawag niyan, TIA. Okay? Many people call it mini stroke.
Okay, I was about to, because you mentioned earlier the little blockages that can lead to a mini stroke.
Pero warning sign yan na ang maxi stroke pwedeng dumating anytime. Kaya anong gagawin natin? I-work up natin ang pasyente kung may bara dito o kung may sakit sa puso. Lalo na yung mga matatanda, minsan irregular ang heartbeat nila, tinatawag atrial fibrillation. Pag irregular ang heartbeat natin, hindi maganda ang pump ng puso, nagkakaroon din ng blood clots dyan. Kaya binibigyan natin ng blood thinner.
Okay. This is upon the diagnosis already of their
Yes.
doctor. So how is it diagnosed? A patient comes to you complaining of the symptoms that you mentioned. How is a stroke diagnosed?
Well, we want to look at the pulse, listen to the heart. We may have to look at the blood vessels from the heart, whether there's block or that, and or not, and we look at the brain. Is there a permanent damage or there's none? Many times in many strokes, you may not see anything. That's good. It means na hindi na block permanently ang blood. So we can recover now. There's one thing I'd like to add with this new technology. Kasi pag na-form yung blood clot and na-dissolve, naging permanente, mamamatay yung brain na being supplied by the blood. Our newest technology, mental exercises lang ito, hindi gamot, will allow or can allow the brain cells to grow back.
Wow.
So para bang...
So brain cells can grow back?
Yes, yes. We have proven that, yes.
Okay.
So now, para bang tayo nasa highway, puntang Baguio, yung NLEX, may banggaan, hindi tayo makapunta na ron. Ang gagawin natin, pupunta ng side road. Iba-bypass natin, makapunta rin tayo ng Baguio.
Okay.
Ganun din ang ginagawa natin sa brain. So if the road is blocked, the highway, we make the brain cells nearby grow back. Okay? And assume the function that was lost.
And it makes for better treatment and better recovery of the patient.
Because there's no drug involved, so there's no toxicity. And there's no drug interaction. Now, it doesn't mean that we should not use drug because we may be dealing with other conditions that require drugs.
Yes.
And we can combine it with drugs if necessary. How is that?
Oh, because normally it's just the drugs that will heal or help the patient recover. But now without the drugs, but with therapy that goes into recovery, then it's going to be better for the patient.
Yun ang basis ng physical therapy, it's speech therapy, occupational therapy. Except na itong technology natin, we have about 75 domains. Kasi we're trying to stimulate all the roads. We're trying to clean up all the roads. Parang, at saka may mga branching yan. Kaya we want them to be working all again. Yun.
So you mentioned cleaning up all the roads, you want it to be working again. Does this also hold true for someone who has been diagnosed with Alzheimer's, a neurodegenerative brain disease?
You know, the early symptoms have been found to be amenable. Nagdi-delay at least ang degeneration nila. This is not a cure by any means. But what we have found through the research done is that this technology strengthens the brain and makes the brain resistant to brain degeneration. So this is good for students, for professionals, for leaders, executives, for newscasters like you and physicians like me.
Yes, for everyone actually.
Don't wait for the symptoms to occur because that's much harder. And listen, we have not taught this, and I've been a professor for many years in the States, and I'm guilty of this. We have not emphasized the importance of prevention and telling our students and young doctors that when you see a patient with Alzheimer's disease, Parkinson's disease, strokes, hypertension, the process actually began many years before.
Yes.
So when you see the patient with memory loss, you're already behind. So you really need to be aggressive.
To catch up.
Yes. So
you really have to catch up and
that is where our current technology plays a very important role.
And what is this technology, doctor?
Well, we call it the Phoenix Brain HQ. All right? And
What exactly is
yeah,
the Phoenix Brain HQ, and
yeah.
is this neuroplasticity?
Yes, this is based on the principles of neuroplasticity and neurogenesis. To our viewers, ang neuroplasticity po ay ang ability ng brain parang to repair itself without drugs.
Okay.
Provided you give the brain enough stimulation and the right stimulation. Second, that it allows the brain to produce more brain cells. That was unheard of.
No, because when we're born, you know, we develop our brain, and as we get older, so tumitigas na yung brain natin, it becomes concrete, and there's no more room for growth.
Yeah. Hindi naman concrete, gel eh.
Gel, okay.
Parang gulaman, ha?
Kasi diba there's this expression, matigas ang ulo, but okay, gel.
So, for instance, and this is done many years ago, if you exercise, for instance, if you have two animals, you exercise the animal every day. It's like a horse. You make the horse run every day and you ride it. And the other horse just stays in the barn.
Yes.
Pag in-examine nyo yung ulo niyan, yung ulo ng nagtatrabaho who's working every day, mas malaki. And it only is bigger because it has new brain cells. Certain parts of the brain. So it is, but this has been done many years ago, but we were very slow in picking it up.
But now we're catching on.
Technology that we have is based on this premise.
Tell us more about this technology that we can grow our brain cells, and at what age do we start growing this?
All throughout, we feel that this works throughout the human lifespan. The brain is plastic, ladies and gentlemen. All right? So
Plastic, fantastic brain.
Yeah. Yeah. So don't worry when you're older. Don't wait. Make your brain. And this is a series of exercises. Okay, 75, and we're gonna increase it more. Modules. So you cannot finish this throughout your lifetime. And what it does again is strengthen the brain. So if you have mild symptoms, it can repair the damaged brain and delay the onset of degeneration. If you don't have it, it makes the brain stronger and resistant to brain degeneration without drugs. It's accessible. It's also inexpensive. No side effects.
What is an example of an exercise? You mentioned 75, just a brief example.
So you have birds flying, all right? And they may be of different colors. And they ask you to hit yung brown bird, for instance.
Okay.
So it's dalawa, then it's computer. This is computer-based, online.
All right.
All right?
Okay.
So it changes the picture, and you are supposed to catch it. So in order to do that, to be good, you have to do it right, and you have to be very attentive. So it increases your concentration. Then you have to remember na the one that they want me to strike out is the red one, for instance.
Okay.
So pag dumating yung blue, wag mo kukunin yun. Kaya you have to remember too. So, and they all come from different angles. So as it gets more complicated, there are more birds, and they can come from different. So you have to identify them. So on concentration, your memory, your vision, so you have to be able to look at different parts of your visual field. So, and that's just an example, all right? So certain professions, for instance, the military is very important, the athletes. That's why I have recommended this to athletes, all professional, and even amateur in Olympics. And we plan to have an Olympic game for this. Wow. Brain technology.
Brain technology, and in training our brain, it will also, as you've mentioned, delay or possibly we won't have any brain concerns or brain health concerns in the future when we've already taken this method.
Yeah. Certainly, we hope that by using this before we develop symptoms, that we can delay if ever there is. And we have computed this in the United States, because in the United States we have at least 5.5 million Americans diagnosed as Alzheimer's disease. How about the rural areas? How many are they who are not diagnosed? So it's really an underestimation, I believe. And we already computed that by delaying the onset of Alzheimer's disease in the United States by a year or two, hopefully 5 years, we will be saving billions of dollars. And the Congressional Committee in the United States Congress has already reported that if we do not decrease the incidence or the frequency of Alzheimer's disease and do not have a more definitive treatment, it could possibly bankrupt the healthcare system in 3 to 4 decades.
How about here in the Philippines, doctor, since you're here to educate all of us on this?
It has been estimated that we have probably 1 million Filipinos with Alzheimer's disease. And let me share this sort of tradition that we have. Alzheimer's disease is not a psychiatric disease. And we should be open to this because as any disease, you can treat better the disease if it's recognized earlier.
Yes.
All right. We should not hide them. We should not be embarrassed if we have a family member who has Alzheimer's disease. So that's one. Secondly, that Alzheimer's disease is not a part of the normal aging process. Because we thought that if you are 55 here or 60 and you'll forget, that's part. Please get tested. And if we have the diagnosis confirmed, then let's start the treatment.
And in starting the treatment, we have to keep our brain healthy, happy, alert, and focused and excited. And that's what we're going to talk about when MedTalk returns.
Did you know that physical exercise can make you smarter? By exercising, you do not only develop a firm body and a healthy heart, your body also manufactures a chemical that makes your brain more open to learning.
We're back here on MedTalk, still talking about brain development. This time, doctor, let's talk about keeping our brains healthy. It's summer. The kids are playing outside, enjoying the summer. And when they get back to school, how will you help them? Or how do you encourage them or teach them to get back into focus, get back into the game of school? How do you train that brain to go back?
I think learning should be enjoyable. It should not be, taught in an atmosphere of fear. And I think that's the basic tenet in teaching. You have to get the kids engaged with you. I've been teaching medical students, and I have to develop schemes or how to get them engaged and get encouraged to remember what I'm teaching them.
Any tips for the teachers?
Yeah.
Who are also on vacation,
well,
but going back to school
This is
soon.
actually very challenging to a group of kids who may not be the same as the regular kids. And many times they're called learning disabled, ADHD, autism. Let us just remember that these kids have a different wiring of the brain. So the normal for this is different from our normal.
Yes.
But we're judging them based on our normal standard, which is to me not good. Okay? And just to cite you an example, Professor Nass, have you seen the movie The Beautiful Mind?
Yes, I have.
Did you know that Professor Nass, John Nass, Born in a very humble, with humble beginning, in one of the poorest states in the Union, in the United States, West Virginia. Was a Nobel Prize winner in 1994 for economic science. Okay, but you know what? He was schizophrenic. So we call him abnormal. Now, if you ask Professor Nas, we are the ones who are abnormal.
To him, what
Yes.
he is or who he
So
is
why
normal.
should we judge him based on our norm when in fact he's even much brighter than many of us combined?
Because that is the
That's
thinking
right,
that he is not.
That's why
normal.
I really don't like those terms, learning disabled, special ed, because those terms emphasize the negative aspect rather than the positive aspect. Because they have other things that they can do very well.
Yes,
Okay?
I agree.
That's one. So the other things that we need to do to preserve good brain function is diet.
What should we eat? Are there certain
Okay.
foods, certain drinks
I
that we should take more of?
Yes, I advocate raw food, in particular, green leafy vegetables, less fat,
Okay.
less cholesterol. So a lechon probably once in a
Once
while.
in a while, okay.
And trying to remove the fat under the skin.
Yes.
And white meat is better than red meat. All right?
Okay. What does it do to our brain when we
Well,
eat this?
cholesterol is very bad. What is good for the heart is good for the brain.
Okay.
What's bad for the heart is bad for the brain. All right?
Okay.
So let's remember that. Cholesterol is very bad. Too much salt is bad. All right? So fruits are very good, particularly the dark-colored fruits.
Okay.
Berries, blueberries. We had the opportunity to look at the data on this too with the Department of Agriculture in the United States. Stress, we should try to limit, and it's easier said than done, but when you're under stress, take a day off. Socialize with your friends and family members, all right? And, have somebody else, for instance, take care of your loved ones if you're under stress.
Yes.
Because stress, particularly depression, can lead to impairment of your immune system. How, we don't know. And caring for individuals with chronic disability like stroke, Alzheimer's disease, Parkinson's disease, the caregivers suffer from depression. So caregivers, I have a conference for caregivers exclusively in the United States.
So eat better food,
Yes.
darker fruits,
Yes.
less stress. How about sleep?
Yes, about 6 to 8 hours we recommend. Although when we get older, we tend to sleep less. But sometimes the quality of the sleep is more important than the quantity of the sleep. All right? Now, physical and mental exercises.
Yes.
We recommend at least 30 minutes 3 times a week.
Physical and mental exercise. What are mental exercises?
This is exactly what we're talking about. The Phoenix Brain Train has all these cognitive mental exercises that try to stimulate the different pathways in the brain. That's why. You don't have to do it this way, but the good thing about our technology is because it stimulates different pathways. Like, for instance, there was a study using our technology against people who were just doing crossword puzzles.
Yes, I was about to ask you about crossword, but you mentioned it already. Please go ahead.
The ones who were doing crossword puzzles did not improve because that's just one way.
Okay.
So our technology improves memory, comprehension, attention span, skills, balance, navigational skills. Okay? And in mood too, it improves mood. So these are very important, and the quality of life.
Which
No.
is the most important,
Yes.
no? For you to be able to function, for you to be able to socialize,
Yes.
for you to be happy and healthy.
And I would
Quality
like
of
to do
life
all
shouldn't
these things
suffer.
in the Philippines, by the way.
Thank
Prove
you.
to our countrymates that this technology could help us achieve a better quality of life, and in all levels.
So thank you very much, Dr. Reyes, for being here tonight, for helping us understand our brain, for helping us rethink how our brain works, and for helping us get to know you more. Since you're here in the country for just a short period of time, we're very appreciative of the time that you've devoted here to
It's a pleasure,
MedTalk.
Angel.
Thank you so
I'm
much,
honored.
Dr. Reyes. Thank you.
you.
See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.